Welcome to Logical Ayurveda. Today we are going to discuss about a disease called Grahani. There are some things in your life that you know for sure. You don't believe it, you are not so confident about it, but you are sure, you know it for a fact. Like if you throw a ball up in the air, it will come down for sure because of the gravity. You know it for a fact. Similarly, there are certain diseases which an Ayurvedic physician know that you can cure it for sure. He know it for a fact that he can cure it. One such disease is Grahani. It makes Ayurveda physicians so confident about the logics of the science. After experience of treating so many cases, the results of this becomes pretty much obvious. One of the beautiful vyadhi we can treat like this is Grahani. It is compared in allopathy or contemporary science. It is compared to many diseases like irritable bowel syndrome, sprue, malabsorption syndrome, ulcerative colitis, even Crohn's disease. But as I said earlier, it is not important to name a disease. It is important to treat a disease on a basis of dosha and symptoms. How effectively you are going to treat a disease is much more important than naming the equivalent of the disease. So whatever name you want to keep it, but treat it properly. So this is a tweet of Mr. Sridhar Vembu, who is a CEO of famous company called Zoho. He stresses the importance of using traditional food for irritable bowel syndrome and how we got the consultation which made him practically disease free for the rest of his life and how he is comfortable. Such big persons who are internationally acclaimed are turning towards Ayurveda, are turning towards traditional foods for curing the IBS. So the Ayurvedic treatments are so efficient and competent, and the principles are laid down on a stone, and it is very easy to treat these diseases. Basically, the definition of Grahani is Grahana means absorption of the food from the intestine, absorption of the required necessary part of the food. That is Sarabhaga from the food is called from Grahana. That is the duty of the intestine, is to proper absorption of nutrients from the food. Grahani is a disease where there is no proper absorption of nutrients from the food. In fact, most of us must have come across the shloka Muhur Baddham and Muhur Dramam. Grahani is such a vyadhi where vata is in play. There will be repeated episodes of constipation or repeated episodes of diarrhea. Stools will be sometimes in solid in consistency. Stools will be sometimes liquid in consistency. Sometimes pain will be there. Sometimes pain will not be there. In ulcerative colitis, stools will be mixed with blood. In irritable bowel disease, stools will be mixed with mucus. So basically, Grahani is a vyadhi where there is no proper grahana or there is no proper absorption of the food from the intestine. As a thumb rule in Ayurveda, like any other disease, like any other treatment protocol, identifying Grahani and giving a single particular medicine does not cure Grahani. Whatever you choose, a single particular medicine does not cure a Grahani. Depending on the Vyadhi Avastha and the perfect diagnosis, the medicine has to be changed from while to while to give a perfect result to the patients, to make sure that he is completely cured and the Vyadhi does not recur back. Before learning about Kafaja Grahani, before learning about how to treat Kafaja Grahani, I will tell you about the Samanya Ashadis that I use in any form of and every form of Grahani. These are the medicines that I use for every patient of Grahani, and only the medicines, that is Sahaushadi, the medicine that are prescribed along with changes, but this baseline medicine does not change. So these three medicines are: one, Samanya Ashadi for Grahani is number one Vilvadi Guliga for each and every patient, including Kafaja, Pittaja and Vataja Grahani. I'll definitely prescribe Vilvadi Guliga. Number two, Madhifala Rasayanam. In Grahani, there is a two aspects. There are two windows of Madhifala Rasayana. One, Amla Rasa. It is Hridya and it is nourishing and it provides strength to the patient and it reduces the Vata. That is number one. Grahani is basically Vata dosha, Muhur Baddham, Muhur Dramam, etc. So Madhifala Rasayana helps in reducing that, number one. Number two, Madhifala Rasayana is rich in electrolytes and it gives intensive nourishment to the patient, often taken at when Whenever old age patients used to take Madhiflorasana, they tell immediately I feel some prasada like effect, some nourishment like effect to my eyes, etc. So it has such a good electrolyte replenishing effect. So for these two reasons, I choose Madhiflorasana, and I choose Vilvadi Gulika because Vilvadi is the basic medicine for Grahani. And number 3, I choose Dadi Mastaka Churnam. Dadi Mastaka Churnam, I will not choose it for everybody, but it's an excellent Stambhaka Dravya when given along with buttermilk, and Sahapana and Anupana differs. But Dadi Mastaka is excellent in stopping repeated bouts of bowels.